Good afternoon. My name is Rachel Larkin. I'm a registered nurse, and today I want to take a little bit of time to talk with you about skincare if you're providing care for a family member or loved one who has decreased mobility and kind of relies on you to help them take care of themselves on a day-to-day basis. Mobility is really an ability to get around. It's the ability to move, to change positions, to kind of take care of yourself in really every way. Having decreased mobility increases your risk for skin issues and skin problems. Decreased mobility can be something that happens for a short period of time, or it can be something that is long-term or even permanent in nature. Either short-term or long-term issues with decreased mobility both require good skin care before problems can develop or worsen, and that can happen pretty quickly. Skin problems can include rashes, tender areas, irritated skin from friction or skin tears, and really the most serious skin issue would be a pressure sore or what is commonly known as a bed sore. Risks for issues with skin problems again include immobility, which is spending a lot of time in bed, spending a lot of time in a wheelchair. Frequently I will hear family members say, oh, well, mom or dad spends a lot of time in the recliner. They eat their meals at the recliner. They'll spend a lot of their time during the day in that chair. Another issue are folks who like to spend a lot of time either on a bedpan or in a bedside commode or a potty chair that people may have in the home. Anytime that you're sitting for a long time, even though it might not seem like very long, but if you're in the restroom, for an hour, that's a whole 60 minutes of pressure on that area of skin. Decreased sensory ability. If you can't feel something, you might not know that there's pressure there. You might not know that that area is starting to become kind of sore or tender. You might not feel what's going on very well. Numbness, tingling, things like that. Poor nutrition and hydration. Food is nutrients, and skin, like any other cell, skin cells require nutrients, and when we don't provide them with enough, they aren't healthy and they start to die off, and you will develop a wound with poor nutrition status over a really long time. So it's important to eat well and stay hydrated. Incontinence issues. This is probably the biggest one. If you're having accidents of bowel or bladder and there is urine or stool on the skin, these are both very irritating in a chemical way to the skin and will cause breakdown very, very quickly if the skin is exposed to that repeatedly or for an extended amount of time. Other risk factors include certain medical conditions. Diabetics frequently develop wounds or sores on their feet and they don't know because they can't feel them. A condition that kind of goes hand in hand with that is neuropathy. And again, that's the decreased ability to feel what's going on in a part of your body. This is why checking skin very often is important, especially for diabetics. Folks with vascular disorders, just because the oxygen isn't being circulated as well, they are at increased risk for skin issues also. Here you'll see I've gone over, again, the medical conditions: diabetes, neuropathy, the decreased sensation, numbness, tingling, vascular disease, and decreased blood flow. Over here, decreased mobility. This is difficulty changing positions, lots of time in a bed or chair, and again, that can be short or long term. Accident, illness, surgery. Short term, maybe someone's sick, they have pneumonia, they're going to be spending a lot of time in bed, they might need some rehabilitation. Injury, illness, surgery, say somebody has a joint replacement. Ideally, it all goes well. They're up and moving about. Sometimes that's not the case. As skin issues can develop really quickly, again, even with the short-term decreased mobility, we need to take good care of skin and really be aware of the status of the skin and things that we can do to make it healthier. Causes of skin problems and injuries include pressure. And this pressure would be over a bony area when you have skin being up against a surface for a long amount of time. It decreases blood flow, and with that decreased blood flow comes decrease in oxygen and decrease in nutrients. And again, all cells, including skin cells, need oxygen and nutrition to stay healthy. The skin dies in this situation. Again, it does occur slowly, but as that pressure is there for a long time, that skin becomes unhealthy and again can die. Friction and shear, those can happen a lot more quickly. They can actually happen just in one incident. Friction is like a rubbing injury. Say a piece of clothing or a piece of bed linen is rubbing back and forth over an area that can cause friction, irritation, damage to the tissues. Shear in a similar fashion is pulling in two opposite directions. Consider somebody who needs to be moved up in bed. As you're pulling them up in bed, you're pulling them against the sheets that are going down. That can result in an abrasion, a skin tear. Again, that's something that can happen pretty quickly. Going back to something that takes a little bit longer to happen is moisture damage. And again, this goes back to the incontinence. If the person that you're taking care of is not able to monitor or get to the restroom in time, leaving that moisture, leaving that stool on the skin is going to cause breakdown. Also, say the person is in bed and they get a bath in bed, it's very, very important that the skin is dried thoroughly but gently so that areas aren't moist and, really providing an opportunity to break down there. There are common sites where you will see breakdown more frequently than others, areas that are just by nature at higher risk. And these are going to be your bony areas. Anywhere that we are bony, so to speak, and don't have a lot of cushioning, either fat cushioning, muscle cushioning, if we don't have that protection, those areas are at higher risk. Certain areas are at greater risk for those in a wheelchair. Other areas are at greater risk for those in a bed. In a wheelchair, you're going to want to consider the lower shoulders and the spine as that person is going to be seated against the backrest of the wheelchair. You want to look at the lower shoulders, at the spine. Also, again, you're going to be checking the tailbone. Of course, you're sitting either in bed or in the wheelchair. You want to check the buttocks. You want to check the tailbone. Really look at those areas and make sure that they're healthy, not breaking down, not red or sore or irritated. In bed, pay attention to the head. If you're on one side of the head or the other, the ear presses up against the head. The back of the head can be very bony as well. Paying attention again to the shoulders. You want to pay attention to hips, even as we're turning side to side, left to right, and to back again. As you're on those hips, left, right, as you're on those shoulders, you really want to be checking those bony areas again as they have pressure points. Pay attention to heels, ankles, and knees, especially the bottom of the heel. The heel shouldn't feel mushy or soggy. That's indication of skin that's not very healthy, that's not doing too well. When you are taking care of someone, it's important to check the skin regularly. You want to make sure that skin is dry, healthy, and there's no issues. Things of particular importance that you want to look for is red skin. Red skin is angry skin. It's normal that after some time of pressure in one position, say you're turning a person off of their left hip, that hip might be a little bit red, but whenever you push, it should turn white. If it stays red and it doesn't give a little bit, that's an indication that that area is starting to experience damage and breakdown. You want to look for areas that are either cold or too warm. Warm skin, irritated. But again, cold, that indicates that maybe the circulation to that area just isn't as good. And going back, if circulation is not good, there's not enough oxygen, there's not enough nutrients getting to that skin, and therefore it's at higher risk. You want to look for skin that is sore or tender, an area maybe during a bath that somebody just shies away from. That skin might be sore and tender because it's starting to break down. That can be one of the earlier signs that there's an issue going on below the surface that you can't necessarily see. Any rashes, any moist areas, any raised areas. A rash can be raised or not raised. It gets usually localized to the area that's being bothered, but if it becomes a fungal infection, it can spread along the area that's affected. Any open bleeding areas, of course, are going to draw your attention pretty quickly. Anywhere that there's decreased sensation, again, for diabetics, if you can't really feel your toes, that's an area that's at risk just because you might not know that there's an injury or a problem starting to develop in that area. Interventions for good skin care. You want to promote a good diet. Again, getting healthy nutrients to that skin keeps those cells healthy and well and reproducing and replacing each other. And it is important to stay hydrated as well. Incontinence care as soon as possible. If you're taking care of mom or dad and you know that they've had an accident, it's really, really important to get in there, to get that wet linen off of the skin, to clean any stool or any urine off of the skin, really using a gentle but effective soap, rinsing very, very well. You don't want to leave soaps on the skin, and really making sure that skin is dry, especially if you're going to be applying any product on top of it. If there's a barrier cream or some sort of product that you use over the counter to kind of protect the skin, that's fine, but you want to be sure that those creams are put on after the skin is dry. Shifting weight and repositioning, this is one of the most important. In the hospital, we aim to do that every 2 hours. At home, you want to do that really almost as much, as frequently as possible, hourly even. In the wheelchair, it should be as often as 15 to 30 minutes. You should be making a big position change and shifting weight in one direction or another. Something that can be helpful for these position changes is what we call a turn clock. And we designate a left, the right, and laying on the back. If you need to write it down when somebody's on their left side, whenever you change them to a position on their back, you just write that time down. And then whenever you go to position them to the right, again, you keep track of it so that you're turning them and spending equal amounts of time on either side. If someone's spending time in a wheelchair, it's very important to make sure that that wheelchair fits them. A chair that's too big or too small can cause issues. Protect the skin whenever you're lifting or pulling. Have help moving someone. There are home medical supplies that you can use, frames for above the bed that allows the person to help you move them. And again, coming down to it, keeping skin clean and dry and checking it daily, really catching an issue before it becomes serious, or identifying areas of concern right away so that you can talk to your doctor about that. It can be very overwhelming taking care of somebody at home, but if you're taking care of them and you're spending time with them, you're going to be giving them good skin care anyhow. Keeping up with skincare is a human rights issue. Something we would all want for ourselves is to be well taken care of and clean. And just a few simple steps of keeping skin dry, checking it often, and eating a healthy diet can really go a long way in keeping skin healthy and promoting the wellness of the people that we're taking care of at home. Thank you so much for your time today.